All right, here's 3 movements that you should be doing when dealing with any kind of neck or pinched nerve type sensation or pain down into the shoulder blade or down the arm, right? It's a pretty common thing, typically with sitting, jobs that involve a lot of like either head forward or down type work, computer looking down, things in front of you. So one, right off the bat, you'll notice that in general, you'll feel better the more straight or up you sit. So the first thing you should be able to do is definitely get your hips all the way to the back of the chair. Use a little lumbar roll through here to help when you control the lumbar posture by getting this curve up this way, it automatically brings your head and neck more in line with your shoulders. So you can see my ear is more above my shoulder when I'm sitting tall, as opposed to when my hips are slouched, it makes my head go forward naturally. Now you'll notice that when my head is forward or down is when most things will make this, or when you feel worse typically. So number one is get your hips to the back, little lumbar roll, and sit up tall, and that will help put you in the right position. Now, leads into number two. Once we're in this position, we want to make sure our shoulders are relaxed, and we're gonna tuck straight back into what's called a cervical retraction. Very simple, well, it's simple, but it's not easy to do because we're not used to it. So we're very good at protruding this way, but I want you to do the opposite. Think about your head coming straight back that way, okay? So it's not down and it's not back that way. It's the whole head on this level plane tucking straight in. You may feel, and it's okay, you may feel like it kind of pinches or sends that pain down the arm a little bit while you're there. So I have pain in the arm, I come back, ooh, ouch, that hurts, it increases it. But then when I stop, no, it calms back down to where it was. Let's say it's a 4 out of 10. I tuck in, ooh, 5, 6 pain. I stop, oh, back to a 4. That's not wrong. That's not a yellow light. Go slow. You may only be able to go like just an inch or so at a time. Maybe you can only get this far before it sends the pain. And then as you practice, go slow, take breaks. You should start to improve and increase the distance you can go and change the actual arm symptoms. So you want the pain to actually feel like it's coming out of the arm and that it's moving up, and it's only in that upper back and kind of scapular area. So even though it may increase it temporarily, that's where I'd go next. So number one, posture. Number two, retraction right through here, okay? And then once you get those two, number three would be to add a bit of lower neck extension. That's typically where this problem is going to be. So the retraction already gets the lower cervical spine to move better into extension, which is where we need to get that direction to change a lot of these lower cervical issues, right? So C5, C6, C7 is typically where probably 90-some% of these problems that cause arm pain are going to be, because that's where the nerves go. C6 goes to here, thumb and first finger, C7 in through here, C8 kind of into that pinky and ring, kind of that funny bone sensation, okay? So 1, 2, once we get this and it's feeling better, then I would start adding some, like letting the head roll back, but you still have to tuck it in first. So you can either go from here and then let it roll back nicely through here. If that's too pinchy, use your hands to help. So you still want to tuck in, so we still have to retract first. Then I'm going to let my arms help me and support my head so it doesn't go quite as far back or as fast, and then come back up. Again, very likely that this is going to increase, but temporarily increase the pain in that shoulder blade, or maybe even shoot it down the arm. But then as soon as I come back up and I stop and I recheck my motion and I give it just a few seconds, 15, 20, 30 seconds, that pain is going to resolve. It's going to kind of melt back away again. And then we're going to keep just working on those three things: posture, retraction, and then retraction with extension. Really letting it just roll over the chair. Don't let your shoulders come up this way. You can't do this and then tuck in. That's got to stay relaxed. And then when you roll back, you can't, it's okay to let the chin come out once you tuck in. Then let it just naturally, just like it's going to roll off your shoulders. You don't have to maintain that tuck on the way back. That's where it gets really hard and it kind of pinches funny. So the only reason for the retraction is just to get the lower cervical, lower neck bones in the right place. Then from there, go ahead and just let it naturally just roll off your shoulders back as far as you can. It's going to pinch. I know right away you're only going to be able to go maybe just that far. Oh, it hurts. That's fine. Come back out of it. as you get going, 10, 20, 30, 40 reps, right? Sets of 10, take a break. Sets of 10, take a break. It's going to start to go further and further and further and further till you're all the way back there and it's not hurting your arm. So in general, that's going to be the steps that I would take for a pinched nerve type sensation, pain going from the trap and shoulder blade down the arm. You know when you have it. I mean, tough to turn to the right, tough to look up, maybe even tilt. Ooh, zings you down. Hard to sleep at night. You may even feel some weakness, like in your tricep or in your hand, picking things up, gripping. There could be some muscular weakness. That's all from that nerve sensation. Okay, thanks. Okay, bonus movement, right? We talked about the other three in the chair. Here's a bonus movement. Number 4. I like to use these TRX straps, but you can use anything where you can hang on to something. And I want you to be able to kind of lean back a little bit, still stay slightly tucked, right? Right in through here. So we're not going to be forward, we're not going to be back, just in neutral. And then really pull those shoulder blades together in the back. It opens up the chest, and it kind of helps pinch those shoulder blades and those upper back muscles and bones and the lower neck muscles and bones. Work through this kind of pumping sensation of pulling together and then stretching forward and keeping the head in neutral. And you can really feel that upper back move, and this feels pretty good, just to get these arms moving. Because usually when this problem happens, we get to be very forward, and we get to be head forward and kind of rounded in front, all the things we do here. So by opening up the chest and pinching the shoulder blades together and staying tall, that should be another bonus movement that you can do to really get some good results from that.